Let's go on to the scalenus anterior muscle. The scalenus anterior muscle is the only muscle that can press on the carotid artery. It can also press, or it does press, on the vagus nerve and the phrenic nerve when it's in spasm, and it pushes on the brachial plexus, so it can pinch the nerves that go down to the arm. So one of the most troubling problems is it pushes on the blood pressure receptor, which is in the carotid artery, just happens to be right directly under the scalenus anterior. So we need to get this thing to release in order to fix a migraine, because a migraine is a headache that is caused by restricted blood flow to the brain. The carotid artery is the only blood flow to the brain, and this is the only thing that can really pinch the carotid artery. So most migraines really kind of have to be this muscle in spasm. So let's release it. Slowly increasing my pressure. Not very much, I have to be really careful. Make sure you're on the muscle. That's the most important thing. Do not slip off the muscle and press on the nerves under it or the artery, because that would be bad. But if you're on the muscle and you're carefully holding it and holding that rotation all the way to the right, encourage them to look to the right and hold it, you'll feel it start to release. Feel like it wants to start letting go. Release your pressure slowly, very slowly, for maybe 1 to 2 minutes, and you'll feel the muscle start to soften, and all of a sudden the range of motion will just open up more. So it usually goes with the big breath. So pull that energy out, open that scalenus anterior muscle up, and when it releases, it'll feel great. And don't press on their ear. The problem I'm having right now with her is actually my hand is touching her earring and it's jamming into her ear. So when you're cradling the head, don't do what I'm doing here. You have to be really careful and not press on people's ears or their jewelry. So anyway, sorry about that. Let's go back to the scalenus anterior. Let me show you a little bit more. So I think you're getting the idea. This is a way to release a migraine. And also, the phrenic nerve controls breathing. So that can, if someone's having shorter breath kind of feeling, it actually can be the scalenus anterior pushed on the phrenic nerve. The vagus nerve will make you nauseous, and even worse, it goes to the heart and the stomach and so on. So and the vagus nerve is very close to where my fingers are. So you don't want to slip off the muscle and push on the vagus nerve, but by releasing this, you'll release the vagus nerve. What that does sometimes is it gets the stomach to start moving, and the small intestine, you'll hear it gurgling when this muscle releases. That's because you're taking pressure off the vagus nerve, and this is actually the way to fix nausea. A lot of people have nausea because the scalenus anterior is in spasm, and it pushes on the vagus nerve, which causes nausea. So let's show you how to release the scalenus anterior on the other side. Let me just go ahead and stop talking for a minute and let you really focus on what I'm doing. If you're trying to do this, just be really careful and stay on the muscles, on the scalenus anterior. Just do the drawings maybe first. Really try to visualize that the scalenus anterior muscle, this one on the left, on her left side, for example, when it contracts, it would rotate her neck to the right, and her head goes with it. So turning her head that way, the way I'm turning it, actually stretches it because it's attached to the side of the vertebra, and we're stretching those wings of the vertebra down towards the actual massage table and away from the first rib, which is under her clavicle, right in the front of her body. So honestly, there are several muscles that can cause neck pain, and any one of them, if they're in spasm, will give someone pain. So if someone's complaining of neck pain, you have to really release every single one of them. The scalenus anterior really is the main one to release. That's the one that pinches all the vagus nerve and the phrenic nerve and the carotid artery and so on. But you also need to know how to release the scalenus medius, which traps the brachial plexus, which are the nerves that go down to the shoulder and the arm and the hand on the back side. So the scalenus anterior actually pushes the brachial plexus into the scalenus medius. So let's show you how to release the scalenus medius here. It attaches to more to the outside of the first rib. Remember, the first rib is kind of a small ring that goes around the neck, travels from below the clavicle in the front. It goes to a little bit higher than the iostite level of the clavicle. So I'm rotating her head towards my hand as I'm pressing into the muscle, which is really stretching the scalenus medius and holding the pressure point. I do the yang-yin pulse, and after I hold the pressure for a while, it feels like it's going to melt, and I can begin the yin pulse. So now let's show you the scalenus posterior. The scalenus posterior rotates the cervical vertebrae in the opposite direction, right? The scalenus anterior and scalenus medius, those are a little counterintuitive. The scalenus posterior rotates the cervical vertebrae in the direction that people guess. So I turn her head in the cervical vertebrae to her left, and that stretches the scalenus posterior on her right. So if I wanted to do her left side, I would rotate her head towards her right side. That's called contralateral rotation. Scalenus anterior and medius are ipsilateral. Anyway, so I'm doing the yang pulse, holding it, and then slowly pulling my pressure off. That's called yin, which is making it feel like I'm holding pressure even though I'm slowly backing out over up to 1 to 2 minutes. You can see it kind of relaxing there. I think, yeah, looks like it. No, I'm going to go back in and get a little bit more here. There we go. Now the levator scapula runs right behind this muscle, so sometimes you can get it confused. I keep on feeling the levator scapula and the scalenus posterior, but this really is the scalenus posterior that I'm feeling that's tight on her. So let me give it another shot of yang. You can see my thumb turning white. That means pushing the blood out. And then I'm slowly backing my pressure out, making it feel like I'm backing out even though I don't leave right away. That's yin. See, it just released. I can see her vertebra change in position. All right, let's show you on the other side. You always want to do both sides with every muscle in the body, but especially with any muscle attached to the vertebra. Let's show it from a different angle here. I like this overhead view. So remember, you want to rotate the head and the cervical vertebra away from the side that you're pressing into when you're going for the scalenus posterior. The anterior and the scalenus medius are the opposite, right? So I'm doing yang, slowly backing my pressure out, making it feel like I'm holding, and that's yin. Okay, let's go on to the semispinalis cervicis. Now let's do the capitis first. Okay, so the semispinalis capitis. The semispinalis capitis muscle emerges from the posterior surface of the upper thoracic and cervical vertebra, and it inserts onto the occipital bone. Its job is basically to extend the head and extend the neck by extending the head back when it contracts. To stretch it, you just have to flex the head a little bit, and you can also just directly traction it. So I'm going to show you a technique here where I'm tractioning the head and pressing straight into the semispinalis capitis muscle. And there's a note about this muscle. It can cause vertigo, or it can be involved with vertigo. The nerve called the vestibulocochlear nerve travels from the inner ear into the foramen magnum with the spinal cord. I know it sounds like a lot of technical stuff, but basically the nerve that carries the signal of both sound for hearing and balance travels between the first cervical vertebra and the head. So this muscle, it can pull the head, it can tilt the head to the left or to the right. And the next muscle I'm going to show you is the semispinalis cervicis, which can rotate the first vertebra to the left or to the right. And if that nerve gets trapped in between, then you can lose your hearing. One can lose their hearing, or they can have vertigo. But in this prone version, I'm tractioning the head with the hand that's also kind of pressing into the back of the head with my fingertip and pressing straight in with my other fingertip with the other hand. So let me show you the semispinalis cervicis. Semispinalis cervicis uses a similar technique, both the supine position like this and also prone. So in the supine position, you're using one hand cradling the head. The other hand is making a ridge with your fingertips, as I'm showing here, and lifting into the cervical vertebra. So by lifting the head and then actually dropping the head, not dropping it, but slowly lowering it back down onto your fingertips, you can apply a lot of pressure. You get the releases on both of these muscles, and you will, I've actually had clients have their hearing come back, and vertigo almost always goes away when you get both of these muscles to release, so good one to know. This is the semispinalis cervicis from the back, and kind of the same thing. See, I'm stretching the head and the vertebra actually with one hand, and pushing into the pressure points of the semispinalis cervicis with the finger of the other hand. And I actually go kind of like shoestrings on a shoe. You feel it traversing, so you get the releases on both of these muscles, and you will. I've actually had clients have their hearing come back, and vertigo almost always goes away when you get both of these muscles to release, so good one to know. Okay, let's go into the spinal muscles next. The spinal muscles, there are several of them, and most of them are actually in the torso section. But I want to show you this longissimus cervicis release, because the longissimus starts pretty far down in the back, and it goes all the way up to the neck. But you really have to release it right here, kind of at the apex of the thorax, see, between the shoulder blades. And what I'm doing with the other hand is I'm tractioning the spine. So I'm using the sacrum as a way to kind of traction the whole entire spine, pulling it tight. And with the upper hand, I'm pressing into the longissimus thoracis muscle, or longissimus cervicis muscle, and catching the spinalis cervicis a little bit also, but it's mostly pressing straight into the longissimus cervicis. So it's a long muscle that attaches to the back of the neck, and it will cause neck pain if it's tight. So we have to include it in this section. Go ahead and watch a little bit, and this is definitely a good one to practice. You can use this same kind of mechanics with any of the spinal muscles, by the way. There are also a couple deep muscles in the front of the neck. The main one I need to show you is the longus colli. The longus colli, the fibers of the longus colli, they come from the front of the spine behind the heart and travel up, attached to the front of the cervical vertebra, but this is behind the throat and everything, so it's pretty deep. You can actually use your fingers to feel between the carotid artery is out on the outside and the throat cartilage is on the inside, to be very careful, but you can feel the fibers of the longus colli come up onto the front of the cervical vertebra. And if you're absolutely sure that you're on muscle fibers, you can press directly down into the fibers of the longus colli and get a release. This release the front of the neck, and this is definitely a good one to know, because the longus colli is involved with, when someone's looking at their cell phone and tilting their head from way up high at the top of the neck. This muscle gets strained quite regularly. So if I ever did make a cautionary note with any of my release techniques, it's for the longus colli and the scalenus anterior. You just have to be really, really careful. Make sure of what you're pressing on before you apply pressure. If you do these techniques slowly and carefully, you'll be sure to release the neck and release neck pain. Once you feel like you have these techniques down, go ahead and try doing this treatment on somebody and follow the steps in the next 2 lessons to make sure that you really learn these muscles and where they are. That way it'll really help you understand how to release them. Until next time.